In the last video, we learned about how to draw an ABG. Now let's break ABG interpretation into simple hack. Step 1. Normal pH is 7.35 to 7.45. Below 7.35 means acidosis and above 7.45 means alkalosis. Now after finding out the pH parameter, we need to look for the PaCO2. PaCO2 ranges from 35 to 45 and you can remember it easily by just dropping the 7 from the pH ranges. Bicarbonate gives the metabolic and kidney clue. The normal bicarbonate is 22 to 26 milliequivalent per liter. Now apply the Rome trick, the respiratory opposite and metabolic equal, an easy way to identify whether the disorder is respiratory or metabolic. After following the Rome trick, in respiratory alkalosis, pH goes up and CO2 goes down, opposites. In respiratory acidosis, pH drops and CO2 rises, again moving in opposite direction. So CO2 changes tells us about the respiratory cause. As in the Rome trick, if pH increases and bicarbonate also increases, it gives us the metabolic alkalosis. And if pH decreases and bicarbonate also decreases, it gives us the metabolic acidosis. So from this we conclude that in respiratory problem CO2 is opposite to pH and in metabolic problem the bicarbonate is equal to pH. Now let's talk about the compensation. First, uncompensated. Look at the pH. If the pH is out of the normal range and either CO2 or bicarbonate is still within its normal range, that means the other system has not started helping it. So the disorder is uncompensated. One system is abnormal, the other system is still normal. And partially compensated. Here again the pH is out of the normal range, but now both carbon dioxide and bicarbonate are out of their normal range. This tells us the opposite system has started reacting to fix the imbalance, but it has not corrected the pH back to the normal 8. So the body is trying but not enough. That is the partial compensated. Now finally fully compensated. In this case, even though CO2 and bicarbonate may be out of the normal range, the pH has been brought back into the normal range, that is in between 7.35 to 7.45. This means the body has fully corrected the pH using the compensatory mechanism. So the normal pH with abnormal CO2 and bicarbonate equals fully compensated. Now let's talk about how the organ compensate. The lungs and kidney are the two main regulator of acid-base balance in the body. The lungs rapid compensation occurs in the minute to hours. The lung control the level of the CO2 which act like an acid. If the body becomes acidic, the lungs increases ventilation, blowing off more CO2 and raising the pH. If the body become alkalotic, the lungs slow down the breathing and retaining CO2 and lowering the pH. So respiratory compensation takes place for the metabolic disorder in this condition. Secondly, kidney is slow but powerful compensation which takes place from hours to days. The kidney regulates the H plus excretion and the bicarbonate reabsorption or regeneration. In acidosis, kidney retain more bicarbonate and excrete more H plus to raise pH, and in alkalosis they excrete bicarbonate and retain H plus lowering pH. So there is metabolic compensation for respiratory disorder, and together lungs handle immediate changes while kidney provide the long-term correction maintaining a stable acid-base balance. Now after discussing the overall approach to ABG interpretation, let's break down this real ABG of an 80-year-old male on FiO2 33%. In this case, the pH is 7.5 to 8. This is alkalosis. PaO2 is 84, which is within normal range for this FiO2, so oxygenation is acceptable. PaCO2 is 25.7. It is decreased and moving in the opposite direction of the pH, so this indicates it is the condition of the primary respiratory alkalosis. Now check for the bicarbonate, which is 20 milliequivalent per liter. It is lower than the normal, meaning the kidney are trying to compensate by excreting bicarbonate. But the compensation is only partial, not complete. Anion gap is 7, which is low. So overall, this ABG shows primary respiratory alkalosis with partial metabolic compensation. So that's the end of the ABG interpretation hack. Stay tuned for more content. Thank you.